Hi, my name is Haley Foston, and I'll be presenting on cardiomyopathy with my case study. The Dallas County Medical Examiner's Office calls to inform you that they are investigating the sudden death of one of your patients. The patient in question was a 23-year-old man recently evaluated in your office after an episode of syncope that occurred shortly after a funeral for a 21-year-old cousin who had also died suddenly. Your patient's episode of syncope was associated with transient mild dyspnea on exertion and palpitations. There was no associated chest pain. The patient denied prior medical illness. He had never been told he had a heart murmur, and there was nothing in his history to suggest prior acute rheumatic fever. Physical examination revealed a forceful systolic heave and an apical precordial impulse. This placed far to the left on the chest wall. The chest radiograph showed cardiomegaly with slight atrial enlargement. An ECG confirmed the presence of left ventricular hypertrophy. His liver enzymes were slightly elevated, but serum markers of cardiac injury, enzymes troponin, were negative for myocardial infarction. The patient had been referred to a cardiologist for an echocardiogram to rule out hypertrophic cardiomyopathy, valvular heart disease, or coarctation of the aorta. The medical examiner relates that the patient collapsed suddenly at work while unloading a truck. Extended attempts to revive him were unsuccessful, and he was pronounced dead at the hospital a few hours later. Hypertrophic cardiomyopathy, also known as HCM, is one of the most common causes of sudden cardiac death among young adults and adolescents. It occurs with a prevalence of 1 in 500 individuals. HCM is characterized by three predominant features, which include myocyte hypertrophy, myofiber disarray, and interstitial and replacement fibrosis. HCM is considered to be a hereditary disease with an autosomal dominant pattern of transmission. 1/2 of all cases are familial in origin. There has been 27 individual genes that have been identified in the cause of the hypertrophic cardiomyopathy. As seen in the case study in the previous slide, the patient's cousin just recently died at the age of 21 suddenly. Stroke volume in HCM is decreased because of impaired diastolic filling resulting from smaller chamber size and poor compliance of the hypertrophied left ventricle. A differential diagnosis of the HCM include hypertensive heart disease. When they did a study comparing the hearts of these individuals, the ones that had hypertension had a mean left ventricular maximal wall thickness of 11.4 millimeters, compared to those with the gene mutation positive hypertrophic cardiomyopathy, which measured up to 18.5 millimeters. Sudden death from cardiomyopathy is agreed to be a result of the lethal arrhythmia. The three features of HCM create a site for electrical instability in these patients that have the hypertrophic cardiomyopathy.